As the pandemic has progressed over the last 15 months or so, I think there's this perception that I see, particularly in the media, that healthcare systems are in this sort of moment of crisis, waiting to go back to a normal state on the other side of jabs. And I think that take kind of gets it wrong. So if we look at the Spanish flu pandemic in 1918, on the other side of that pandemic, we saw the emergence of nationally and employer-funded health schemes, which were really new, as well as the emergence of sort of modern public health and the acceptance of epidemiology as sort of valid medical science. And so, taken at a high level, the way that people access care and provided care changed. The way that we paid for care changed really quickly, and the way that we studied care really changed. And so if we sort of fast forward to today and think about where are we going on the other side of this pandemic, the idea that we're in crisis mode, I think is less salient. I think organizations that are really innovative are looking around and seeing increased digitization, the leveraging of non-traditional infrastructure to provide care, and new actors in the care system as really important plugs to a system that had holes to begin with. And so really innovative health systems aren't thinking about crisis mode anymore. They're thinking about how do we leverage the infrastructure that we've stood up during COVID to actually provide better care in the places and spaces that people actually want it. And so organizations that really shift this type of planning, that are asking themselves how to sustain gains in health equity and health access, are going to do really well as the health system continues to change and evolve really quickly over the next 12 months or so.